cool, bud. Where do you want to sit? Want to sit in the colorful side?
Here, baby, hold.
What do you think? You want to sit in here, that room? Pretty colors in it? I think you'd like that side. I think you'd like this side, bud. It's more colorful. Brand new dentist, bud. We're gonna get you fixed up. Got it, bud. Playing with them curves.
Good job.
A room with a view.
It was raining earlier a little bit.
It
Yeah,
was,
cold.
yeah,
I mean, with
definitely.
the rain and the cold and the wind. I kind of like it. I'm enjoying it.
Yellow orange.
Yellow orange color, yeah. His face turns yellow orange. Yeah. I see.
So like that.
Like what?
Kind of broken.
Oh, dead. Battery's
Just
dead.
needs
No,
new
it's not
battery,
broken.
buddy.
We'll put batteries in it for you. No worries.
Growing up, did he like have a favorite food?
It was always either chicken nuggets or bean burritos.
Oh, not growing up, but no,
Oh,
his thing was
chicken nuggets.
chicken nuggets.
All chicken nuggets all the time.
Nuggets, chicken nuggets.
He liked that protein.
He was just hooked on it. That's all he ever wanted, nothing else.
So lately, earlier this year, we found some meatless nuggets
Oh,
that
yeah.
he likes.
Yeah.
And
Oh, he
they're-
likes them?
Yeah.
Oh, that's
They,
good.
They actually, I
we
tasted
tasted
them.
them
They're
like-
good.
JJ, be careful,
Nice.
buddy.
You don't touch
You
the
wouldn't be
equipment.
able to tell that they were not
No.
chicken?
You cannot tell.
I liked them. I tasted them just because I was curious,
Oh,
and it was
man.
good.
Perfect
wow.
texture.
And they're
Like,
healthier, you know, we're trying. And then he was to where he liked sodas, but we were trying to cut him off that a lot. You know, he still drinks it occasionally, but we could get those water drinks, those ice, what are they called?
sparkling
Yeah,
sparkling
he
ice.
loves
He
those.
loves
Really good,
those.
yeah.
I mean, they got the buzz, so it's like soda, but they're healthier.
Exactly.
Can't wait to meet the doctor,
Yeah.
the dentist.
We'll ask him too when he first comes in if I'm okay to video him.
It's always good to get permission.
Yeah.
I can't believe how much stuff costs with that fiber.
My one.
Can I have it? Is it mine? 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 Oh, you're so handsome. Are you comfortable or what, dude? We see each
You look super comfortable.
Yep, our big problem, the reason we're here.
Jonathan?
Yes, we
Or
call him
man.
JJ.
JJ. So it's been a little bit since JJ's been seen by a dentist?
No, he would go for his normal cleanings and everything, but the reason we were referred here is because he can be really difficult.
Okay.
And they said that he had a little cavity in his left
I
bottom.
think so. This was
And-
like a year
and-
ago, but they
and,
could never
yeah.
get a look at it.
And
Okay.
he won't let him do x-rays, he won't let him do anything, so
Okay.
he's gonna have to be sedated.
Does he, any medical conditions, heart, respiratory, kidney,
No,
nothing
no.
like that?
His doctor sent his,
Physical?
yes.
In our anesthesia,
They cleared
obviously,
him,
we'll do all
yeah,
that.
because he does take a lot of meds, but nothing that's,
All behavioral?
yeah, well,
Yeah.
I mean, the
Yeah,
most
that's
of
what
it,
it
yeah,
is.
most
Sleep,
it's
help him
behavioral,
sleep, and
That's it,
behavioral.
that's it.
Has he ever been put to sleep before?
Yes, it was when he used to go to Kachina, he smashed his finger in a gate at the school and they
Okay.
had to knock him out to clean it.
Okay.
And he did well.
Does he do okay with like a blood draw or like an IV? No. So it's going to be a question of how do we initiate the anesthesia because he's a big guy. And without the ability to start an IV, so our options are for most patients breathe a mask and go to sleep.
Yeah.
He may be too big for that though. That and it'll be a question for the anesthesiologist.
Oh, okay.
The next
And
one.
to me, that seems like it'd be the easiest.
It would, but you also have to cooperate to have a mask
Right.
fully covering him. And I mean, if he doesn't want something
Well,
on,
to
True,
let you know
too.
something, I mean, when he had a sinus infection and the doctor had one of those masks that you used to breathe in the little comfort thingy.
yeah,
And at first he didn't want to do it, but he started doing it. So I think he might.
maybe. Another option is a quick shot. That's faster than the
It would
IV.
probably take a bunch of us to bring him down, but.
And then the last one is
Loud.
and sometimes we'll do it with a mask with
It's
like
loud.
laughing gas, kind of like a heavy duty laughing gas, and then try
Loud.
to stick the IV at that point.
Yeah.
That
Um,
would, I mean, whatever can get him to where he's calm, so calm he's in a chair.
The other thing is we can pre-op them with medicine that's like Valium. It's not going to put them to sleep, but sometimes it just slows them down a little bit. That we can start the IV. And I'll tell you my experience, if they come and they sit in the chair, if they're cooperative enough for that, oftentimes between either the laughing gas or pre-op pill, we get IVs in people where, you know, parents and guardians have said, oh, there's no way it's going to happen.
Yeah, I mean, I'm curious to how they did it in the hospital, you know, because they didn't let us in
Well,
there, so I don't know.
he might have been a lot smaller.
He was.
So
Oh, yeah, he was.
That's
He's crowded within a year.
that's a lot of times a limiting factor.
Yeah.
Is, you know, when they're smaller, it's easier to
True,
get through it.
Yeah, he's very strong.
Oftentimes, you know, we'll put them to sleep, and the first appointment when they're asleep is just cleaning, exam, and x-rays. If he needed something small, like a little filling, I would do it. But if he needed a mouthful of work, we'd
No.
schedule another visit for that. And if he hasn't had x-rays before, there's just no way of knowing.
I don't know how they
exactly
saw
what
the
he needs.
cavity without an x-ray, but they said there's one there.
Yeah, so it's-
During the exam, they saw
I'm gonna
something.
see that.
Okay.
So you'll get an idea what he's like here, I think.
Yeah.
So this is
I mean, he's
good.
happy today, so he may be okay.
Yeah.
All right, let me let's see. Can I take a look here? Can you open it?
Good boy.
Remember open wide.
Here's look.
Real big.
Open
Good
wide.
shot.
Open big bun.
That's okay.
Jay, remember, you've done it many times before.
We're just
Say
gonna look
open
one
wide.
time. No,
Remember,
that's okay.
Hey, look at me. You want to get your teeth fixed? Yes? Okay.
open wide for
Just
him.
let him see it. He's just going to look.
One,
No
1, 2,
tools.
3, and we'll be done.
1, 2, 3. Ready?
1, 2,
We'll
3, we'll
count.
be done.
Ready?
Ah, good job, good job.
Two.
Visually, I mean, things look pretty good. It does look like I might be able to see one on the lower right.
That's
Lower
where it
right.
was.
Okay.
But it's
maybe
hard to
lower
tell.
right.
There might also be one on the I just, I
Yeah,
You know
can't.
what I mean? He's like,
Yeah.
I
he's
can't
scared.
see.
It's
Yeah.
more fear than anything.
I mean, we brush his teeth twice a day, no matter what. So.
I think a pre-op pill is going to be, will he take a pill, you can crush
We
it?
crush it,
yes,
yeah.
And just like a sip of
absolutely,
water?
Yep, yep.
Absolutely.
Okay, I would do Ativan, 2 milligrams. And we'll try that and just, you know, the anesthesiologist that morning will kind of figure out you
Yeah.
know, how we're going to start.
Yeah, yeah. Sounds good.
Worst case scenario, say we just can't get it done. At that point, we refer to a hospital.
Okay.
with a
That's what they
dentist.
were saying in
Yeah.
another, but they ended
But
up
it's,
putting him on
it's,
this.
yeah, that's the problem is they book out a couple years.
Yeah.
Wow.
And the only thing they're going to do different is they just have orderlies that can physically restrain and then start, which,
Can you imagine what that does to them?
that's
though?
why we try to avoid it.
Yeah.
Like,
That's why we try to avoid it.
torment them. They'll never want to do it again.
Yeah.
Can I see your hand here, buddy? Good shot. I mean, see, he's great veins, so if we can just slow him down a little bit, the IV process is real quick.
I mean, they had to have done that in the hospital,
For
right?
sure,
Yeah,
it just might have been they
now,
put him to
so-
sleep before they did it.
Right.
And that's
They
that's
probably
the
used the
trick.
mask, I bet you. I bet you
Maybe.
did that.
Well, we'll
Whatever works. Mm-hmm.
We'll see what we can get done. Well, they'll help get you scheduled. We'll take good care of them, and we'll
So
see.
the next
awesome.
visit is more of an exam,
The next visit, he's gonna go to sleep.
right?
We're gonna get X-rays. We're gonna clean his teeth. If there's something small I can do
Right away? Okay,
Okay.
that's perfect.
All right.
That's awesome.
I'm going to let Terry know who does the scheduling. She may not schedule you right now because they
Okay,
may have to get
that's
some
fine, I
prior off
understand.
with the insurance and all that, but we'll take good care of it.
Okay,
Okay.
You're awesome.
Thank
Thank
Nice
you.
to
Yeah,
meet you.
my pleasure.
I
Yeah,
feel really good
pleasure to
about this
meet you.
place.
Yes,
First
yes.
one,
Good.
it felt good.
Yeah, I've been almost 20 years in practice. I've devoted, my whole career to treating adult patients with special needs. My dad is a retired MD anesthesiologist.
Right.
We practiced together the whole career. He's retired now, but Dr. Waters, our new anesthesiologist, is great.
Great.
And we do this every day.
Dr.
which-
Serban says he refers a lot of people
Yeah,
there.
yeah,
I'm
and
thankful
well,
for him.
one big difference between us and a lot of other dental offices, is we have a full-time anesthesiologist, so we literally do this every day. It's not once a month and we kind of dabble in it. It's how we're set up.
That's awesome.
We'll take it.
Love it.
find out what day we're gonna schedule, and then I will email his doctor and see if he wants any blood draws.
Okay.
And if he does, then I'll tell him what you need.
What I'm gonna tell the scheduler is,
Oh.
I'd like to try to do this on a Monday.
Fine.
Mondays are quieter for us, and I think that this process is gonna take a little longer
Any
than
day's fine,
what of a
that's
lot of
fine
our
with
days.
us.
And what it's also gonna do is afford me the ability of a little more time that if
Taking
he's got a
time.
couple of cavities, I can probably get a little bit more done.
Okay.
Okay.
One other question I was just thinking, would you be able to be his primary dentist? Like
For sure,
Yes,
absolutely.
that's what we
Awesome.
want to
That's
do.
what we're
Yeah,
hoping.
that's my intent, is moving forward, we'll see him.
I mean, he was
Yes,
getting
yes,
too big
yes.
for Thunderbird Children's Dentistry, really. I mean, when he first started there, they were able to wrap him
Right,
up like a brood
right,
and grew
right,
out of that
right,
thing. But
right.
yeah, awesome.
Yeah, we'll take care of him for sure.
Awesome. Thank you so
Nice
much.
meeting you.
You as well.
He's great.
I know.
Come on, you did good, hon.
Yeah.
I'm proud of you. Now, what do you want to go get for lunch?
Do we get up yet, or?
Yes.
Yeah. Okay. You
Hi,
can get
baby.
up.
Thank you.
Let's go, buddy. Come on. We're all done here.
Okay, we'll give you a call once we receive the authorization from
To
you.
schedule it?
Yes.
Okay.
So we'll get a call.
Yes.
Okay.
Thank you.
Awesome.
Yeah, of course.
It's nice meeting
Thank
you
you so
guys.
much.
Have a great day. Thank you.
Hey, come on, buddy. It's awesome. Have a great day. All right. You like this? It's a good place, Bubba.
That was easy, huh, buddy? Wow. What do you think of that dentist office? Did you like it? They're nice, huh? He is a sweet dentist. I like
Yeah, I
him.
like him a lot. Everything about him is.
You and I mean,
Perfect.
he's got that good bedside manner. I mean,
Yeah.
he's like,
I mean, he's like in there and he knows what he's talking about right off.
totally
and-
understands.
Yeah.
That's exactly what we needed. I am going to ask Dr. Servin though about that.
About what?
About if he wants to get any blood, that would probably be a good time to do it. Yeah, we're staying with this one. Come on, honey. JJ, you got to get out of the road. Come here, car's coming.
JJ, you got to get out of the road, bud. Do you have any sense of danger, bud? Come on now. Getting some hail. It's hailing, bud. Another chicken bite. Pretty cool. Let's see if I can catch some. Hey, look, here's one right here.
Now we're clogging it up.
Got one right here on the car. A little ice. They melt so fast, though. Wow. It's crazy, right? That's pretty cool. Okay, it's 4:30 in the afternoon. JJ's content, laying in his bed. Got his iPad, got his glowworms, and he's got his pen. This is what he wanted. Wanted me to put his pen in his room. That makes you happy? Yeah?